everyday woman, woman, woman in every way. Yeah, yeah, I'm living my life.
Everyway Woman presents the symptoms and prevention of breast cancer. Welcome to Everyway Woman. We're talking all things breast cancer. We've got some doctors here from BreastLink answering a few of our questions, but I want to talk about symptoms in particular. Are there symptoms of breast cancer, Dr. Bremer?
There can be symptoms, yes. Luckily, most women that we see in our centers, we pick up the actual cancer or the abnormality on a mammogram.
So they have no symptoms.
Exactly. So I'd say the majority of patients do not have symptoms. However, if patients do present with a symptom, it's usually a painless lump is what they usually present with.
But what about the women who feel like something's wrong in their body or they have almost that intuition?
Like they're always burning or something, like it's on fire.
Okay, we need to talk about that.
Having a feeling is good. You come in and you get it worked up. That feeling doesn't necessarily always mean that there's something going on. However, I think it's good to be in tune with your body and come in and get that thing checked out.
So there's nothing to say about like fatigue or, breast tenderness, soreness.
Yeah, certainly, I think any change in your breast should be addressed with your provider. That can include swelling of the breast. That can include drainage or discharge from the nipple. Particularly if there's blood within the discharge. I mean, there are
Is that likely?
Some patients
well,
present
how do you know the blood's
in that way.
coming out? Like,
you would see it?
You can see it. Dr. Bremner's had patients that have come to her with that as a complaint. Any new lump under the arm, any new lump in the neck, any inflammation of the skin over the breast.
Wait, a lump in the neck? What does that have to do with the breast?
Well, like we talk about, patients can present at different stages, not just stage 1, but sometimes stage 3, where a lymph node may be in the neck or under the arm that may be
felt.
So
it's spread to the lymph nodes?
It can spread to the lymph nodes. So any of these changes, anything that the patient finds that's new, not her typical, she should have that addressed with her physician.
How about if a woman just has pain and no lump? Is that a beginning of a symptom?
I see many patients with breast pain on a daily basis or a weekly basis. And so again, the approach is you get the imaging, you get your mammogram, ultrasound if necessary, to rule out that anything is going on in the breast.
But
however,
we've all had like sensitive breasts during our period. Is it more painful if it's cancer or does it feel the same?
Traditionally, cancers do not present with pain. So when patients come to see me, I say, normally we don't worry about pain. We actually want to rule out that there's anything going on with a mammogram and ultrasound to make sure definitely there's nothing going on. However, cancers normally do not present with pain.
So the symptoms then of cancer are more
painless lump,
but the side effects are the treatments essentially, right? I mean, you have more symptoms because of treatment.
Right. So you're talking about a patient who comes to us for the first time. And that can, as mentioned, can be localized to the breast. Patients that have, in rare cases, come to us with breast cancer that's spread throughout their body may have other completely unrelated symptoms.
But is it maybe women are pushing themselves too hard? At what point do they need to take it seriously and slow down a little bit?
And do the breasts get like hard, like stone or something?
They can. They can get swollen. They can get red, inflamed, and firm and hard on examination. And there are some patients who come to us very late in the process. They see something, they want to ignore it, they're scared. And these are women with advanced degrees, professionals, highly intelligent women who see this, are scared, and suppress it in the back of their mind.
Are they just rationalizing it?
Yes, in denial. It's a state of denial. And we see these patients, unfortunately, on a fairly regular basis.
Why are women doing that?
It's a personal reaction that a woman may have to not want to deal with a possible cancer diagnosis.
Is there at-home tests that we can do? Because, I mean, I'm Latina, and a lot of in the Hispanic community, a lot of us are too scared to go to the doctor, and that's another topic. But my question is is there anything we can do?
Self-breast exam is a good test to do at home. Other than that, it's getting your regular imaging. You definitely want to stress monthly self-breast exam, get familiar with your breasts, and then yearly mammograms.
But when do we know then when to take it seriously? As these professionals that you're saying are rationalizing or in denial, or they're scared to go to the doctor, like Anna said, at what point do we have to say, okay, I need to see a doctor?
I say see the doctor from the very beginning, and let the doctor navigate you.
Yeah, but even you just said most women aren't going to see a doctor at the very beginning. They're going to think, I'm too busy for this. I don't have the money for this. I mean, we make up these excuses.
And he's saying they need to go
and that's
see a
why
doctor,
we're here,
especially if you're feeling something in your breast.
Yeah.
And
It's
we
hard.
see, we see plenty of patients for screening mammograms that have no problems. So that's the place to start. You get hooked up with a doctor, you get your mammogram, you see a doctor after you get your mammogram, you get examined, you're reassured. See you next year for your next mammogram. Stay on top of these things. Because the earlier you find it, the less treatment potentially you'll have, and the better off you do.
Let your doctor and surgeon be the one to say, this looks okay, we'll just watch this. It shouldn't be the patient, it should be the doctor or the surgeon.
So the lesson is essentially, don't over-rationalize it. Present any questions to your doctor immediately.
Absolutely.
Don't wait. Perfect. Exactly. We'll be back with more on breast cancer and prevention with the Doctors of Breast Link here on Every Woman. Stay tuned. We'll be right back.